Good day, esteemed WHO leader and policymaker. Thank you for giving me this opportunity to speak. I am Oluwatoyin Onamade, a public health doctoral student at Walden University Minneapolis, and a medical scientist with over 15 years experience in Australia, specializing in diagnostic testing and molecular research. Previously, I served as a testing operations senior project lead during the COVID response in Department of Health in Victoria. During that unprecedented time, the disruption and loss were enormous. We must ensure to prevent such crises in future. Today, I just want to bring an urgent public health issue to your attention. The role of COVID-19 booster, laboratory testing in advancing global equity and preventing new variants. With our interconnected world, the emergence of vaccine-resistant COVID virus could lead to another renewed outbreak, lockdown, and grave economic setback. This calls for need for a global commitment to equitable vaccine booster access alongside robust genomic surveillance to monitor and address the emerging variants. Without action, we risk more severe pandemic in future. I asked for policy to support mobile labs in low and middle income country with local education and training. Secondly, policy to establish booster production in low and middle income country for equitable access and booster vaccine and boost funding for support for COVAX production. Lastly, policy to invest in digital platform for genomic surveillance enable proactive variants tracking. According to WHO 2020, COVID-19 since 2020 has infected 704 million people, causing over 7 million deaths. This is a great loss. While high-income countries have genomic surveillance to adapt the booster to evolving strains, low-income countries face significant barrier. This disparity undermine the equity and highlight the urgency for the policymaker to address this inequality and reduce the global public health risk. None of us is safe until everyone is safe, as stated by the President of the European Commission. The booster strategy targets high-risk population, including the older adults and immunocompromised, who remain vulnerable even post-vaccination. Study from Abbas in 2023 reported that Omicron was originated from unvaccinated area, which caused the second wave of the pandemic. JAMA research in 2022 indicated that the booster significantly reduced hospitalization, yet low middle income countries struggle with access, infrastructure, and finances despite COVAX initiative. The inequality highlights the need for critical coordination of policy to respond and protect the vulnerable population worldwide. According to Hampton et al. In 2022, boosters are essential to sustaining herd immunity, and it helps the vulnerable group, particularly the elderly and the low and middle income country. The current gap in booster vaccine show ethical failure. There's also a responsibility to prevent a new variant by making booster vaccine available and also the genomic surveillance widely. The current inequality in booster not only harm the people in undeserved area, but pose a global threat to emergence of new variants and breach the ethical principle that everyone must have access to life-saving intervention regardless of their status. To prevent future pandemic, I call on WHO policymaker to champion the policy to support the local genomics lab and training in low and middle income countries, international funding for COVAX to boost the production, and global digital platform for surveillance of variants of concern, ensuring global security and trust. Together, we can ensure healthier and more equitable future. Thank you so much for your commitment to these vital issues.